Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
No. Management of vesicoureteric reflex. One important thing in vesicoureteric reflex is to make sure the child does not land in infection. That is, we should keep the urine sterile. Make sure that there is no urinary tract infection, and we can wait for spontaneous resolution in the child. So, medical management is the one which is mainly recommended for these children as initial management. So, for all the prepubertal children with grade 1 to grade 4, these cases will usually resolve. In all from grade 1 to grade 3 children, they will mostly resolve. But the problem comes in grade 4 children. In grade 4 children also, we can try for medical management itself, especially in younger children with unilateral grade 4. If there is unilateral grade 4, then we can try for medical management. Then, in the medical management, the drugs used for medical management. So, the drugs will depend upon the age of the child. If the child is up to 6 weeks, then we can use either amoxicillin or ampicillin can be tried. If the age of the child is after 6 weeks, if the age of the child is after 6 weeks, then the biliary system of the child is mature enough to handle the trimethoprim sulfamethoxazole. So we give this trimethoprim sulfamethoxazole is given to the child after 6 weeks of age. So this trimethoprim sulfamethoxazole is the drug of choice for prophylaxis also. So this trimethoprim sulfamethoxazole is usually we give nighttime doses are given, whereas the other option we can give is also nitrofurantoin can also be given in these children. So but the first line or drug of choice for prophylaxis is trimethoprim sulfamethoxazole for children aged after 6 weeks of age. Then if you see, you will give amoxicillin ampicillin for child less than 6 weeks. After 6 weeks we give trimethoprim and sulfamethoxazole. But if we found out that there is resistance to the agent is seen, if there is resistance is found out, then we can give both the drugs alternatively in the morning and in the evening. If we found out that there is a resistance to the drugs, then both the drugs, the true drugs, can be given alternatively in the morning and in the evening. And we have to obtain periodic cultures should be done every 3 months for evaluation of any breakthrough infections. That is, in between the drugs, whether there are any infections or not. For knowing that, we should do periodic cultures every 3 months. Then we have dimercaptosuccinic acid scan can also be done if there is any recurrent pyelonephritis. If there is recurrent pyelonephritis, then we can do dimercaptosuccinic acid scan is done, and we can do yearly radiographic studies can be done for resolution. This is medical management.
thank you and thank you for watching.